Okay, thank you, merci. Good afternoon, and thank you for joining us at this technical briefing on the COVID-19 vaccine rollout in Canada. With me today are Major General Dany Fortin, Vice President of Logistics and Operations at the Public Health Agency of Canada, and Dr. Tom Wong, Chief Medical Officer of Public Health of Indigenous Services Canada. We will each provide brief remarks and then open the floor up to your questions. Arianne Reza, the Assistant Deputy Minister from Public Services and Procurement Canada, is also here to assist in answering your questions. As of today, more than 1,153,000 doses of COVID-19 vaccines have been administered in Canada. This means that 2.4% of Canadians have received at least one dose of vaccine and 0.5% have received two doses. Also, more than 50% of healthcare workers targeted for priority vaccination and more than 50% of residents of congregate living settings for seniors have received their first dose. It is important for us all to remember that the vast majority of Canadians remain susceptible to COVID-19, and we continue to see outbreaks in hospitals and long-term care homes, correctional facilities, congregate living settings, Indigenous communities, and more remote areas of the country. Taking these realities into account, I will emphasize, as I do here almost every week, that the key to controlling COVID-19 is to follow public health guidance on gatherings, social distancing, wearing masks, and other measures as we wait our turn to be vaccinated. Thank you. Bonjour. Merci de vous joindre à nous pour cet exposé technique sur la distribution de vaccins contre la COVID-19 au Canada. Le Major-Général Dany Fortin, vice-président de la logistique et des opérations à l'Agence de la santé publique du Canada, et le Dr. Tom Wong, hygiéniste en chef de la santé publique pour service aux Autochtones Canada, se joignent à moi aujourd'hui. Nous fournirons chacun nos commentaires et ensuite vous pourrez poser vos questions. Arianne Reza, sous-ministre adjointe des Services publics et Approvisionnement Canada, est également avec nous pour répondre à vos questions. En date d'aujourd'hui, plus de 1 153 000 doses de vaccins contre la COVID-19 ont été administrées au Canada. Cela signifie que 2,4% de la population canadienne a reçu au moins une dose de vaccin et 0,5% en a reçu deux. Plus de 50% des professionnels de la santé qui ont priorité à la vaccination et plus de 50% des personnes âgées vivant dans les lieux d'habitation collectifs ont reçu leur première dose. Il est crucial de se rappeler que la grande majorité de la population canadienne est toujours susceptible à la COVID-19. Nous constatons toujours des éclosions dans des hôpitaux, des établissements de soins de longue durée, des établissements correctionnels, des habitats collectifs, des communautés autochtones et des régions éloignées du pays. Dans le contexte de cette réalité, je dois insister, comme je le fais chaque semaine, que le meilleur moyen de contrôler la COVID-19 est de suivre les consignes de santé publique portant sur les rencontres, la distanciation sociale, le port de masque et toutes les autres mesures en place, tandis que nous attendons notre tour pour être vaccinés. Merci. Et je cède maintenant la parole au Major-Général Fortin.
Bonjour à tous. Good afternoon, everyone. To date, the Government of Canada has distributed a cumulative total of 1.4 million doses of both Pfizer, BioNTech, and Moderna throughout the country. The distribution of this week's shipment of 70,000 Pfizer, BioNTech doses is almost complete. The manufacturer has indicated that we should receive approximately 403,000 doses next week and 475,000 doses the last week of February. Pfizer has also confirmed shipments into March. As of now, the Government of Canada anticipates receiving 444,000 doses weekly for the first 2 weeks of March. The quantity of doses in the upcoming shipments also reflect the recent label change authorization from Health Canada. And for the remainder of March, we expect to share numbers with the provinces as soon as possible. We are on track to receive 4 million doses by the end of March. The Vaccine National Operations Center continues to work closely with provinces to understand their needs in enabling equipment following Health Canada label change authorization to Pfizer-BioNTech vaccine. The The NOC also, the NOC's work includes ensuring provinces have sufficient stock of recommended syringes, as previously mentioned. As for Moderna, last week, Government of Canada received 180,000 doses. The vast majority of those are now distributed, and the final shipments, small shipments to remote and Indigenous communities will be completed next week. The first Moderna shipment, the next Moderna shipment is expected to arrive in Canada the week of February 22nd and will include 168,000 doses. The remaining doses of Moderna, to round out their commitment for first quarter of 2 million doses, are expected in March. Government of Canada continues to work with the manufacturer to confirm the exact doses and dates for upcoming shipments. Now, moving ahead, we are still expecting to receive 20 million doses of both approved authorized vaccines between April and June. The delivery of vaccines to Canadians is an ongoing effort, and we work relentlessly on ensuring that it's done as timely and as effectively as possible. So despite temporary delays, efforts are going as expected, thanks to collaboration of all levels of government. Alors, bonjour à tous et à toutes. À ce jour, le gouvernement du Canada a distribué aux provinces et aux territoires un total de 1,4 million de doses des deux vaccins, Pfizer, BioNTech et Moderna. La distribution de l'envoi de 70 000 doses de vaccins de Pfizer-BioNTech cette semaine est presque terminée. Le fabricant a indiqué que nous devrions recevoir un total d'environ 403 000 doses la semaine prochaine et 475 000 doses au cours de la dernière semaine de février. Pfizer a aussi confirmé ses envois de début mars. À l'heure actuelle, le gouvernement du Canada s'attend à recevoir 444 000 doses par semaine pendant les 2 premières semaines du mois de mars. Les quantités de doses indiquées dans ces envois tient compte de l'autorisation récente de Santé Canada de passer de 5 à 6 doses. Pour ce qui est du reste du mois de mars, nous prévoyons communiquer les quantités aux provinces le plus tôt possible. Nous sommes dans la bonne voie pour recevoir les 4 millions de doses telles que prévues d'ici la fin mars. Le Centre national des opérations des vaccins continue de travailler avec les provinces afin de comprendre leurs besoins en matière d'équipement de base et les stocks nécessaires pour donner suite à l'autorisation donnée par Santé Canada à Pfizer-BioNTech de modifier les étiquettes pour refléter chaque fiole contient 6 et non 5 doses. Le Centre national des opérations doit, entre autres, vérifier que les provinces disposent de quantités suffisantes des seringues recommandées et nous continuons cette distribution. Le gouvernement du Canada a reçu 180 000 doses du vaccin Moderna la semaine dernière. La majorité de ces doses, environ 170 000, a maintenant été distribuée et on est en voie de procéder avec les dernières distributions dans les communautés éloignées au cours de la semaine qui vient. Le prochain envoi de Moderna devrait arriver au Canada dans la semaine du 22 février et nous attendons à ce qu'il contienne environ 168 000 doses. Le reste des doses du vaccin de Moderna pour l'atteinte de son engagement d'atteindre 2 millions d'ici la fin mars est attendu en mars et le gouvernement du Canada continue de travailler avec le fabricant pour confirmer le nombre exact de doses par envoi et les dates exactes de ces prochains envois. Alors, en conclusion, on s'attend à recevoir à l'avenir 20 millions de doses de ces 2 vaccins autorisés à partir d'avril, entre avril et juin. La livraison des vaccins pour qu'ils parviennent jusqu'aux Canadiennes et aux Canadiens demeure un effort contenu par toute la grande équipe ici. On travaille sans relâche là-dessus. Et malgré les retards temporaires qu'on vient de vivre, nos efforts se déroulent comme prévu grâce à la collaboration, entre autres, de tous les différents paliers de gouvernement. Merci. Je passe maintenant la parole à mon collègue.
I want to acknowledge that I'm on the unceded territory of the Algonquin people. With increased risk of transmission of COVID-19 variants, it is essential for us to double down on public health measures such as hand washing, wearing a mask, avoiding gatherings, and staying home if we are sick or if we are being asked to self-isolate, and getting the COVID vaccine. We are seeing encouraging vaccine uptake in Indigenous and territorial communities. As of February the 8th, over 72,000 COVID vaccine doses have been administered in 344 First Nations, Inuit, and territorial communities, reaching 12% of the population vaccine dose target at a rate that's 6 times that of Canada's. Par exemple, en réponse aux cliniques du vaccin menées par les Inuits et supportées par les gardes forestiers et la province, l'Unitsivut a connu une augmentation à 70% de la prise du vaccin chez les adultes. Une clinique de vaccination de la COVID-19 dirigée par les Autochtones en collaboration avec la province a ouvert à Winnipeg cette semaine. Ce site est pour les travailleurs de la santé engagés dans les communautés des Premières Nations du Manitoba, ainsi que pour les guérisseurs traditionnels et les gardiens du savoir. La clinique aura environ 900 rendez-vous disponibles pour les premières doses dans les prochains jours. Miigwech, Nakumik, merci, thank you, et merci.
Merci, Dr. Wong. Nous allons maintenant passer à la période de questions. As usual, we ask that you limit yourselves to one question and one follow-up. Vous pouvez poser votre question et une question de suivi dans la langue officielle de votre choix. Operator, over to you.
Thank you. Our first question is from Karina Roman from CBC News. Please go ahead.
Yes, hi there. You've got the opposition criticizing the rollout of the vaccines from the very beginning. Today, you have, Bloc Leader Blanchet characterizing the call that the Prime Minister made to India as we're going begging for vaccines. What do you make of that characterization and the idea that, even though you keep saying we're going to get our vaccines by September and everyone who wants one will get one, how can you be so confident that that's going to happen when we've had all these supply problems and you've got this characterization that now we've gone begging for vaccines to other countries?
Dr. Njoo, should I start, Dany, or do you want to go first?
Sure. This is General Fortin here. I can tell you that we are working with the two approved vaccines. We will get 40 million of each of those vaccines over the coming months in total. We're working with we're on trajectory for a total of 6 million doses at the end of this quarter, 20 million in the next one, and so on and so forth. So I think it's very promising. We're on the right trajectory, certainly with the information that I passed on with Pfizer. And we're working very closely with those manufacturers to provide those numbers. So that's what I would offer at this point.
Yeah, it's Dr. Njoo. What I would say, if you look at what we indicated back in December of last year, we were anticipating maybe even getting vaccines sort of the early part of this year. And so the fact that we were able to secure some vaccines, in sort of mid-December, late December, I think was actually a bonus in some ways. And Major-General Fortin and colleagues in provinces and territories were able to sort of ramp up, as you say, almost do a sort of a proof of concept in terms of setting up the clinics, the logistics, and so on. And as we've indicated, we also know even now today that this first trimester is a period of relative scarcity. The vaccines are just being ramped up in terms of being produced, for a global market. And Canada, we have our place. We've indicated, and I certainly at this point, along with Major-General Fortin, agree that the indications are still there for the delivery of the Pfizer vaccine, 4 million doses by the end of March, and for the 2 million doses of Moderna by the end of March. We've had a few hiccups, but overall, I think we're still on track. And there's every sort of anticipation that once we get into April and further, we'll be getting many, many more millions of doses. I think it's about 20 million doses overall for the second trimester and so on. So that's what I would offer as well at this point. Thank you.
Thank you. Follow up?
Yes, my follow-up question is, can you give Canadians a sense of why then, because we hear so much about it, why are we so far behind the UK, as an example? What are the main factors? Is it just supply? or are there other things that, when you see their numbers of percentage of who they've vaccinated so far and where we're at, can you give Canadians a clear picture of why we're behind and whether we'll catch up or whether, we just have to accept that we won't, our final vaccinations will just have to, be later, that September will be what it is. But I guess I don't really get the big picture there on why we're so behind the UK.
It's Dr. Njoo. Maybe I can start. I think it's always challenging to compare different countries because every country has its own particular context. Geographical factors, the way the healthcare system is set up, and so on and so forth. So I think we just need to focus and concentrate on Canada. We're on track. Certainly, the doses are being rolled out as we've just indicated, making good headway in terms of our seniors and also our healthcare workers, and as well in the Northern Territories. I think the rollout's gone very well. Obviously, challenging during our winter time. So I would say that let's just focus on Canada. Can't really speak to the experiences in other countries. I would say is that yes, look at the UK. I don't want to comment or criticize any country. You see that the vaccine rollout's going in a certain direction. But if you look at the overall epidemiological situation in UK as well, they're having a tough time just with COVID-19 in general. So you can look at one aspect of the overall picture, as you say, in terms of the vaccine rollout, but you also need to take into account what the overall situation is, the extent of community transmission, how the other public health measures have been put in place and are working, and so on. So I think it's not just the vaccination itself that needs to be looked at. Thank you.
Thank you. Prochaine question.
Thank you. La prochaine question est de Raymond Filion de TVA. À vous la parole.
Oui, bonjour. Question pour le Major-Général Fortin. Major-Général, est-ce qu'on doit s'inquiéter de ne pas avoir encore de chiffres pour les livraisons du mois de mars, pour les dernières semaines à venir jusqu'au 31 mars? Vous dites qu'on est en voie d'atteindre l'objectif des 6 millions de doses des deux compagnies, Pfizer et Moderna, mais alors comment se fait-il qu'on n'ait pas de chiffres à ce moment-ci?
Oui, certainement. Merci pour la question, Raymond. Je pense qu'on a... alors, je viens de partager des chiffres pour Moderna. Je peux vous confirmer qu'on est sur la bonne trajectoire. On est en train de communiquer avec les provinces et les territoires à propos des prochaines livraisons. Alors, vous comprendrez qu'il y a un peu de travail de synchronisation à faire ici. On travaille sans relâche ici pour nous assurer qu'on reçoit le nombre de doses appropriées, étant donné toutes les variables qui sont en jeu. Et puis, on coordonne étroitement avec les provinces et territoires. Alors, ça, c'est en jeu présentement. Et puis, on sera en mesure de confirmer rapidement, bientôt, les chiffres pour mars pour ce qui est de Pfizer. Pour ce qui est de Moderna, on est encore en train de travailler à... on a les chiffres pour dans 2 semaines. On est sur un cycle de 3 semaines. On nous indique qu'on devrait pouvoir accélérer la fréquence des livraisons sous peu. Et puis que la production va prendre son envol, va vraiment... il va y avoir une croissance significative sous peu. Alors, les deux compagnies nous assurent qu'on va atteindre les objectifs qui ont été fixés pour le trimestre, nous assurent qu'on est en bonne voie pour augmenter considérablement la production au cours des prochains mois, et puis qu'on peut s'attendre d'avoir à coups de millions des doses au cours du mois d'avril et plus. Alors, je reviendrai à ce que j'ai dit à plusieurs reprises, ainsi que mes collègues, depuis décembre. On est dans une période de quantité tout de même limitée de vaccins au cours du premier trimestre. On a commencé plus tôt. On étire un peu le peu qu'on est capable de produire un peu partout dans un marché global, un marché mondial avec une forte demande. Et puis, les manufacturiers sont en train d'accroître de façon significative la production. Il n'y a aucune indication du contraire pour l'instant. Alors, je tiens à vous rassurer qu'on est vraiment en train de travailler sans relâche à aller chercher les vaccins qu'on a besoin. On est confiant, suite avec notre relation avec les manufacturiers, que les chiffres vont se concrétiser très, très rapidement.
Mais les chiffres de livraison par semaine de Moderna, vous, est-ce que vous les avez ou vous n'avez encore donné aucun chiffre pour mars Moderna?
On travaille des projections pour le mois de mars qu'on partage avec les provinces. au cours des prochains jours, on sera en mesure de confirmer comment ces allocations vont se concrétiser au Canada.
Merci. Next question.
Thank you. The next question is from Ryan Tumulty from National Post. Please go ahead.
Yeah, starting next week, sort of as you detailed, we're going to see a lot more vaccines here than we've seen sort of really at any point during the pandemic, and that, according to your timetable, is just going to keep ramping up into April. I'm wondering how confident you are that the provinces are prepared to administer, potentially tens of thousands of doses every day, and meet the demand for the incoming vaccines.
We're in constant conversation with provinces and territories. In fact, you will recall we had tabletop discussions, exercises, rehearsals with provinces, territories, and other stakeholders back on the 2nd and the 9th of December. There was also additional low-level coordination efforts there have been throughout the last several weeks. We are well aware at all levels of the scope and size of what we will face in the coming weeks and months. Provinces are assuring us that they have good plans in place. There's still more work. There's still more work to do for sure at all levels in the coming weeks. But the provinces have solid plans for health human resource capacity in terms of equipment, cold chain enabling equipment that will be positioned, reprioritized accordingly. So we're in a good place, and we'll have additional coordination in the coming weeks leading into the month of April.
Follow up. Yeah, and specifically on I know you've ordered low dead space syringes and you've received some of them. Do you think the supply chain for those syringes, as well as the storage space that's necessary for the vaccines, will be able to stay ahead of the anticipated deliveries?
So we have millions of syringes in circulation. And I'll ask my colleague, Ms. Reza, who was just about to answer. I'll ask her to complete my answer. But we're in a good place now with the distribution of syringe. We continue to distribute as they become available to provinces so that they are able to administer as effectively as possible the 6 doses of vaccines. And we'll continue to pay attention to distribution to the right place at the right time of vaccines and ancillary supplies. I'll ask Ms. Reza to complete from a procurement side.
Thank you. I would just add that from the front end, we continue to globally source the supply of these syringes. So we do have supply coming in almost on a weekly basis of these precious syringes. But over and above that, we continue to look for some contingency planning so that we can secure access to this supply so we can deliver it to the provinces and territories. And in terms of storage, absolutely, I believe that there is a strong network across Canada of storage depots that are able to actually house it and then send it out for immediate use. Thank you.
Thank you. Next question.
Thank you. La prochaine question est de Hélène Buzetti du Devoir. À vous la parole.
Oui, bonjour, Major-Général. Ma question est pour vous. J'aimerais bâtir sur celle de mon collègue Raymond Filion. Jusqu'à présent, donc, vous avez obtenu 1,4 million de doses. Vous nous avez fait un bilan des doses que vous attendez d'ici la mi-mars et ça totalise à peu près 1,9 million. Donc, pour un total de 3,3 millions de doses. Il en manque donc 2,7 millions pour 2 semaines restantes avant la fin du trimestre. Est-ce vraiment réaliste quand vous dites qu'on est on track?
Bon, alors, je pense que je me suis peut-être mal exprimé. On a seulement au cours des prochaines semaines, on a environ 1,4 million en plus de ce qu'on a déjà. Alors, je peux vous assurer que, alors premièrement, il y a 5 semaines au mois de mars quand on regarde la façon dont le trimestre est bâti. Et puis, on s'attend de recevoir des quantités semblables à ce qui est déjà annoncé pour les 2 premières de mars. On sera en mesure très bientôt de confirmer ces quantités et la distribution au sein des provinces. Alors, moi, l'information que j'ai, c'est très clair qu'on atteint 4 millions à la fin mars.
Mais c'est pas supposé être 6 millions avec Moderna. Mais I have a question for Ms. Reza. I'm sorry, I'm not sure you speak French. I don't remember. I just wanted to know because with this recognition that there's 6 doses in each vial, technically Pfizer can send 17% less containers and still meet its obligation, the contractual obligation. So I was wondering, is there a clause in the contract that would allow Canada to pay up to 17% less for those doses? Thank you.
Thank you for that question, and it gives me an opportunity to clarify what I said at the beginning of the week. So earlier this week, the regulator authorized Pfizer-BioNTech to change the product monograph and label for its COVID-19 vaccine. So it reflects, as we know, that each vial contains 6 doses of vaccine. So provided that Pfizer is meeting their requirement to us, which is to deliver the first 4 million doses by the end of March, and the vial size is deemed compliant by the regulator, there's no contractual issue as it relates to the transition from 5 to 6. We understand that the challenge for some end users is to consistently extract the 6 doses. We are working very closely with the provinces and territories on a transition approach that will focus on training and supply of the right type of syringe. So, as I noted in my earlier answer, we're working around the clock to secure the right type of syringes, and we will continue to do so. So, in general, there is no contractual clause because, again, the point of emphasis is we buy doses. The doses are now in adherence with the regulatory change, and we are working to provide the tools to allow the provinces and territories to make that transition to make 100% use of the doses. Thank you.
Thank you. Merci. Prochaine question.
Thank you. The next question is from Mia Rapson from the Canadian Press. Please go ahead.
Hi, my first question is about the syringes. I'm just wondering if any of those deliveries to the provinces have actually happened, but also knowing that the provinces are saying that they're having trouble. I think many of them have said half, maybe even at most 80% of the time they can get this 6th dose. If we can't, and it requires these syringes, if we can't get that 6th dose or we can't get the syringes, is there any clause in this agreement with Pfizer that would require them to replace the doses we can't get, especially if these syringes, which we know are hard to come by, don't arrive as we need them?
This is General Fortin. I think it requires 3 of us to answer your question. So I'll speak to the front part of it. We are distributing syringes. They have been distributed to all provinces or in the process of by the 15th. In some cases, they will arrive in the coming couple of days. So all provinces will have sufficient quantities for the next several weeks. And more are coming and more will be distributed as they become available.
Yeah, it's Dr. Njoo. I can add from the public health perspective. I'm not sure that you say reports from the provinces, territories. I would say that that was maybe in the past in terms of their experience using maybe a range of different syringes and so on. But certainly, I think we move forward now that the monograph has changed to indicate that there are 6 doses that can be reliably and consistently extracted from each vial. We're supporting the provinces, territories. We just had a webinar yesterday in terms of a training and sort of ensuring that there's good technique from sort of the vaccinator perspective. I think we had a very good turnout. I think it was about close to 2,000, 1,800 participants on that webinar. That was in English. We have another one in French tomorrow. And we'll be also moving forward with additional sort of educational support. So that's on sort of the human factor. And of course, from an equipment perspective, as Major General Fortin, I'm sure Ms. Reza will also speak to, we're working closely with the provinces and territories to make sure that we have, quote, the right equipment out there in terms of minimizing sort of the wastage you might get from a vial by using the low dead volume syringes. Thank you.
Follow-up?
Sure. I didn't get the part about whether or not there's a clause in the contract if we can't get these doses or we can't get the syringes. But my follow-up question, I was just wondering if you could walk us through specifically how many doses of Pfizer and how many doses of Moderna have we actually received to date, so that we can because the website hasn't been updated, and I just want to make sure that we're working with the right numbers of how many we've received and how many we'd still need for them to hit their contract for the first quarter.
Yeah, certainly. So the website will be updated shortly. I think we are scheduled to update it tomorrow now that we have more line of sight on the numbers. So to date, I'm tracking that we have distributed 1.33 million doses of Pfizer alone. So with, and that includes this week. If you count 400 plus every week moving forward, you will meet the 4 million in the first quarter. That's certainly the projections and the numbers that I said earlier with 403, 475, 444 twice. And then we're on that trajectory to the end of March with similar quantities.
Thank you. Merci. Prochaine question.
Thank you. La prochaine question est de Catherine Lévesque de la Presse canadienne. À vous la parole.
Oui, bonjour. J'aimerais rebondir sur les calculs en termes de doses parce que respectueusement, les chiffres ne fonctionnent pas. Comme l'a mentionné ma collègue Hélène, voilà, avec les chiffres que vous nous avez donnés aujourd'hui et ceux qu'on s'attend à recevoir dans les 4 prochaines semaines, on arrive effectivement à 3,3 millions de doses. Vous avez dit hypothétiquement qu'on aurait environ le même nombre de doses pour les 3 dernières semaines de mars. Écoutez, même si on a environ 450 000 doses pour ces 3 semaines-là de Pfizer, par exemple, une autre livraison hypothétiquement de 250 000 doses de Moderna, on n'arrive quand même pas aux 6 millions de doses. Donc, pouvez-vous nous expliquer comment est-ce qu'on va pouvoir arriver aux 6 millions de doses ou est-ce que, parce qu'actuellement, les mathématiques ne fonctionnent pas? Merci.
Certainement. Alors, c'est très clair qu'on a besoin de mettre à jour notre page web. Maintenant qu'on a un peu plus de certitude sur le flot de vaccins Pfizer-BioNTech au cours des prochaines semaines. Alors, on sera capable de mettre ça à jour. Maintenant, on a reçu 1,33 million de doses de Pfizer-BioNTech. Selon mes calculs, avec les chiffres que je viens d'annoncer, c'est 1,76 million de doses. Alors, le Delta représente 1,33 million de doses restant pour les 3 semaines de mars. Alors, peu importe comment on le divise, ça nous amène à 4 millions de doses le 31 mars. Puis, je peux vous confirmer qu'on est sur la trajectoire, sur cette trajectoire. Pour ce qui est de Moderna, effectivement, les chiffres, le total des doses Moderna à date, incluant le 168 000 qui s'en vient, il y a un delta d'à peu près 1,3 million de doses de Moderna au cours qui devront donc être livrées au mois de mars. Le manufacturier nous assure qu'on va atteindre cette cible. On n'a pas de raison de douter et on est en discussion constante avec eux pour avoir visibilité sur leur production, sur leur cédule ou leur horaire de livraison. On s'attend à passer de 3 à 2 semaines, livraison aux 2 semaines sous peu. Et puis, on s'attend d'avoir 2 livraisons en mars, comme j'ai mentionné précédemment, je crois, lors de la dernière conférence de presse. Alors, on est en train de s'aligner avec eux sur les quantités. Et puis, lorsqu'on aura une certitude sur ces quantités, on sera en mesure de coordonner étroitement avec les provinces et territoires et divulguer ces chiffres.
OK, très bien. Merci pour les précisions. Donc, est-ce que vous pouvez nous dire à quel moment environ on devrait passer à des livraisons aux 2 semaines pour Moderna? Puis, est-ce que je veux juste bien comprendre, est-ce que vous êtes confiant qu'on va avoir 2 millions de doses de Moderna d'ici la fin du trimestre? Parce que là, vous avez semblé là, émettre un doute.
La compagnie Moderna nous assure qu'on va recevoir notre total de 2 millions prévu d'ici la fin mars. Alors, c'est l'information avec laquelle je travaille aujourd'hui. C'est l'information avec laquelle le gouvernement du Canada travaille. Et puis, nous sommes confiants qu'on a une bonne visibilité avec Moderna. On a un excellent rapport avec Moderna et puis ils vont nous informer s'il y avait difficulté quelconque, comme ils l'ont fait alors qu'ils ont dû ajuster leur livraison au cours des dernières semaines. Mais on s'attend à ce que leur capacité de production grandisse d'une façon significative au cours des prochaines semaines. On nous indique qu'on devrait avoir des livraisons 2 fois au mois de mars Et je pense que c'est le moment où on va basculer vers des livraisons aux 2 semaines, mais je spéculerais à ce moment-ci à savoir si c'est effectivement ce qui va se passer au mois d'avril et ainsi de suite. Alors, dès qu'on aura ça, on pourra revenir dans une conférence de presse et confirmer cette information.
Merci. Thank you. Next question.
Thank you. The next question is from Abigail Bimman from Global News. Please go ahead.
Hi, thanks for taking my question. Dr. Njoo, I heard you say earlier that it's hard or we shouldn't compare our country to another country, but in the big picture, Canada's 38th in the world when it comes to our rollout. So I'm wondering how you justify this. Maybe you don't want to compare to one, but there's 37 other countries on the list. Why have we not been able to procure, distribute, and administer vaccines at the rate of more than 30 other countries in the world?
Well, like I said before, it's difficult to compare countries with different factors in play. I think really the focus should be, what we're doing here in Canada. Of course, we're always looking to see what can be adjusted. As we indicated earlier, we recognize that this is the most complex immunization campaign ever undertaken in the history of our country. And so, there will be things that come up, things that we'll have to adjust and be flexible about. And I think we're on track. We recognize as well that there would be a scarcity of supply because of the global market, in the first trimester. So I think, yes, you could compare us now to other countries, but I think what's maybe more important is to see what happens following the first trimester, which we indicated very clearly would be a period of relative scarcity. And once, hopefully, we anticipate with optimism that we will get many more millions of doses come April and onwards, and then the sort of the vaccine rollout across the country, I think certainly we anticipate will be ramping up. Thank you.
Thank you. And thanks. I also wanted to ask about the federal quarantine hotels. People are complaining about poor communication and a lack of transparency around their stays here. And some of that secrecy is then feeding misinformation online. So I'm wondering if there's a plan to improve communication around how and why people are being held in these facilities moving forward.
Okay, maybe we can probably unpack that at a future press conference. Certainly, I think in terms of what we're doing at our international border, the federal government is taking a much more, I think, a stronger stance in terms of incoming travelers to Canada. We all know about the pre-departure test requirement now for air travelers. We're looking actively at what measures could also be looked at in terms of our land border crossing points. We're also looking now, obviously, as you mentioned, with our quarantine facilities. I can't speak to individual incidents, but certainly the thinking there is that people who come into Canada, we've always indicated, need to have a clear quarantine plan that meets our expectations for them to, quote, safely quarantine themselves, but also not be in a situation where they might be putting others at risk. For example, if they plan to go back home and someone else living at the home is very, very elderly or a healthcare worker, certainly that wouldn't meet the criteria for our sort of quarantine plan expectations. And so, in those types of circumstances, yes, those individuals would probably be directed to a federal quarantine facility to manage their quarantine. So, not getting into specifics, I would say that there are some details and other aspects of our I think our stance at the international border that will be, I think, unfolding, and certainly will be indicating that in the days and weeks to come.
Thank you. Merci.
So the communication is an important part of that.
Merci. La prochaine question est de Laurence Martin de Radio-Canada. À vous la parole.
Oui, bonjour. Ma première question est pour le Major-Général Fortin. Est-ce qu'on peut s'attendre à avoir dans les prochaines semaines et dans les prochains mois des nouveaux retards dans la livraison de vaccins, ou vous pensez que tout ça, c'est vraiment derrière nous?
Oui, merci. Ça serait totalement spéculatif de ma part. On a mentionné à plusieurs reprises et les manufacturiers nous indiquent à quel point il peut y avoir des fluctuations dans les productions, comme on a pu voir avec les deux manufacturiers. Mais certainement, il y a des indications qu'on est en train de sortir de ça avec Pfizer BioNTech, et Moderna nous indique que la production va augmenter de façon significative. Alors, Je pense qu'on n'a aucune information à cet effet-là. On n'a aucune raison de douter qu'il pourrait y avoir un problème majeur de production en allant vers l'avant.
Merci beaucoup. Puis ma deuxième question serait pour Dr. Njoo. Bon, vous dites qu'il y a seulement 0,5 des Canadiens qui ont reçu une deuxième dose. Par contre, il y a plus de 2 là, qui ont reçu une première dose. Est-ce que ça vous inquiète là, que ce délai entre la première et la deuxième dose puisse être de plus en plus étiré là, par les provinces?
Non, les chiffres sont des chiffres. Et on sait que qu'est-ce qui se passe sur le terrain dans les provinces et territoires, c'est vraiment pour les autorités aussi, les spécialistes, et les personnes qui sont en charge pour l'administration des vaccins. Moi, je pense en général, c'est un enjeu actuel. On continue de discuter avec nos homologues des provinces et territoires. C'est quoi, comment dire, l'intervalle, comment dire, optimale entre les deux doses. On sait que le fabricant Pfizer et Moderna ont indiqué aussi avec l'approbation de Santé Canada, c'est comme 21 jours, 28 jours. Mais avec l'expérience, on voit aussi qu'est-ce qui se passe actuellement dans les autres pays comme par exemple Israël. Et il y a des bonnes comme dire, indications que peut-être même si l'intervalle est un peu plus long, que on a déjà un bon niveau de protection avec une dose et même un délai ou peut-être un intervalle plus long, c'est pas grave pour les personnes déjà vaccinées parce que on peut peut-être vacciner un plus grand nombre de personnes. Donc, c'est quelque chose, ça continue à évoluer avec les données probantes et nous autres, on continue à avoir des bonnes discussions, des échanges d'informations avec nos homologues des autres pays comme Israël pour apprendre aussi à peut-être appliquer les leçons apprises, les bonnes pratiques ici au Canada. Merci.
Merci. Thank you. Next question. Prochaine question.
Thank you. The next question is from Cormac McSweeney from City News. Please go ahead.
Hi, Major-General Dany Fortin. I believe you might have been asked about this in French, and I apologize. I've been in and out due to filing responsibilities. But in English, just on the Moderna vaccine, you gave pretty clear numbers for Pfizer, how much we received to date, how much we're getting, and how much we are expecting towards the end of March to meet that goal. What about Moderna? How many have we received so far, and how much are we expecting for them to make up in March in order to meet their goal of 2 million doses?
Thank you. We have over 500,000 to date Moderna doses. I'd have to verify if that's actually a true statement. And with the next shipment, we'll be at about 1.3 million. I think I mentioned that before. 1.3 million remaining for the month of March. And at this time, we expect it to be delivered. We have been told that we could expect to have this delivered over 2 different shipments in the month of March. The quantities per shipment is unknown at this time. We expect to have that in the next couple of weeks. And when we have that and we have socialized this with provinces and territories, we'll be able to bring that to a future press conference.
And just as a follow-up, this is for Dr. Njoo. There's a story in the CBC today about provinces only using about a fraction of the rapid tests that they have received so far. The best being PEI using 25% of the tests that they've received. Are you concerned about provinces not using a vast majority of the rapid tests they've received? And what will that mean moving forward as we see variants take hold in a lot of these jurisdictions?
Well, I will say is that certainly the federal government has done its part in terms of acquiring these rapid tests. And I think just to be more sort of detailed, we're talking probably about the antigen tests, which is a different type of, I think, technology with a different level of performance compared to what we've always talked about, the gold standard PCR molecular test. They've been distributed. I think over 18 million of these sort of the antigen tests have been distributed to the provinces and territories. And we've also given good support with respect to guidance our laboratory colleagues have put forward good guidance in terms of how these tests are best used, not sort of in isolation, but as part of an overall testing strategy and approach. For example, maybe on a regular basis in a screening type of way, for example, in long-term care facilities, maybe other workplaces where there's a high risk of exposure due to close proximity and so on. So I think we certainly anticipate that the provinces, with the guidance, and also I think gaining a certain level of experience and comfort with this type of test, which is I think relatively new, maybe compared to the molecular test. We anticipate that the use should be increasing, especially in settings where we know are certainly high-risk settings, long-term care facilities. We've had indications in our discussions with the provinces and territories that they are ramping up. I understand that several provinces are really moving forward very, I think, vigorously in terms of implementing these types of tests in those settings, long-term care facilities in particular. So I think it's on the right track, and we're looking forward to having these types of tests being a more widespread use, obviously, to help us, as you say, monitor, make sure that we are identifying people who possibly are affected with COVID-19, but certainly as well, it's also part of our overall approach to monitor the maybe emergence of the variants here in Canada.
Thank you. Merci. Next question.
Thank you. La prochaine question est de Anne-Caroline Desplanques du Journal de Montréal. À vous la parole.
Oui, bonjour. Merci de prendre ma question. J'aimerais revenir sur les seringues spécialisées qui sont nécessaires à la distribution des doses de Pfizer. Premièrement, est-ce que ça va être aussi nécessaire d'utiliser ce type de seringue pour les doses de Moderna? Et à ce stade, quel est votre horizon d'approvisionnement en nombre de ces seringues?
C'est Arianne Reza de Travaux publics. Je peux commencer avec la deuxième partie de votre question. On a déjà commandé plus de 72 millions de seringues à Stade d'Espace Nord et les livraisons sont déjà en cours. On pense que le calendrier de livraison ça va commencer à la fin janvier et on espère qu'on va recevoir à peu près tous les millions de seringues par la fin de l'été. Alors, on pense avoir beaucoup de ces seringues au Canada dans les prochaines semaines. Merci.
Merci. Question suivie.
J'avais une autre question dans ma première question au sujet de Moderna. Est-ce que Moderna aussi exige l'utilisation de cette seringue pour ces fioles?
Je vais tenter à répondre à la question seulement pour noter que ce serait quelque chose qui serait mieux placé à Santé Canada dans leur au sein de leur autorité. Alors pour l'instant, on n'est pas au courant de ce point.
Il y a sur la ligne des gens de Santé Canada. Est-ce que personne peut répondre?
C'est Dr. Njoo, peut-être je peux commencer une réponse. Jusqu'à date, c'est sûr, pour les deux vaccins, il y a toujours une certaine quantité, comme je ne sais pas en français, peut-être Dany peut m'aider, overfill, un peu une quantité de plus de volume de liquide pour les vaccins. Et on sait, avec Pfizer, c'est vraiment comme dit, des chiffres qui sont très exacts parce que moi, je peux peut-être, par exemple, dire que le fiole contient comme 0,45 millilitres de vaccin, puis il faut ajouter comme 1,8 millilitres de diluant, c'est comme une solution de saline, et puis avoir le vaccin total, c'est 2,25 millilitres, et chaque dose, c'est 0,3. Donc, c'est très important d'avoir des seringues spécialisées à faible volume mort pour minimiser un peu le gaspillage. À chaque fois, on tire une dose. Je ne sais pas, mais je comprends pour les fioles de Moderna, avec comme des quantités de plus, ce n'est pas peut-être la même situation comme Pfizer, mais en effet, pour moi, peut-être comme un médecin, je trouve si on peut avoir l'équipement de seringue qui peut minimiser le gaspillage en tirant une dose de n'importe quelle fiole, c'est toujours mieux. Mais Major-General Fortin, est-ce que vous avez quelque chose d'autre à ajouter?
J'ajouterais simplement que pour l'instant, c'est essentiel d'avoir les seringues appropriées, spécialisées, à faible volume mort pour extraire la 6e dose de Pfizer. Je pense que c'est ce qu'on a déterminé et c'est ce qu'on est en train de distribuer en quantité assez impressionnante. Il n'y a pas eu d'indication de la part de Moderna ou des professionnels de la santé que c'est requis pour avoir les 10 doses dans la fiole. Et puis, si cette situation change ou si le besoin est là, on devra s'ajuster en conséquence. Mais pour l'instant, il n'y a pas eu aucune indication en ce sens.
Merci. Prochaine question. Next question.
Thank you. The next question is from Tonda McCharles from Toronto Star. Please go ahead.
Hi. This question, well, actually, I'm not sure who can answer it. I'm hoping you can answer it. Minister Anand has told us that Canada's COVAX supply, the shipments that Canada might get, the AstraZeneca doses that we could get, would be coming from South Korea. What I'm trying to understand is where Canada's AstraZeneca supply under the main contract we have with AstraZeneca, once it's approved, if it is approved, where that supply will come from. And I'm trying to understand what it means that you have an application from AstraZeneca on the website that I understand Health Canada is treating like a separate vaccine from India. What that means? Does that mean that our contracted supply from AstraZeneca would necessarily come from India? Can someone explain to me what that India connection in the AstraZeneca application is, and if there's another country where we expect our contracted supply to come from?
Oh, it's Arianne Reza from Public Works, so perhaps I'll start and then hand off the question. I think it's really important when we talk about supply chains and contracts that we understand two pieces of information. One is that the supply chain is considered commercially confidential. So we don't normally explicitly talk about it publicly. However, that being said, I think that there's a real opportunity to reassure people in terms of supply that it's the regulator, through the regulatory submission that the various pharmaceutical companies submit to them, that reviews the manufacturing process and where the vaccines are coming from, that then is the pivot for where we can get our supply from. So I wouldn't want to leave the impression that contracts limit where the supply comes from. It actually uses the flexibility from the regulator and the supply process to be able to get supply from wherever it meets Health Canada's regulatory approval. So,
Dr. Njoo, I was just going to basically concur with what Ms. Reza says, is that at the present time, the AstraZeneca vaccine is not approved in Canada. The company has made a submission, obviously, to Health Canada regulators, and as part of that package of information and data, which obviously others are not privy to, including myself, there are included, I would anticipate, information about, as Ms. Reza indicated, about the manufacturing, the sites, and so on, and that would be all taken into account by Health Canada in terms of their approval process, and then depending on what their approval is, that will then, I think, in some ways determine, how Canada will be procuring its approved vaccines. Thank you.
And we have time for one last follow-up. Kanda?
Thank you. There are no further questions registered.
No,
at
we
this time.
have room for one follow-up.
Oh, I'm sorry.
Kanda?
I'd just like someone just to clarify. Did I understand you to say that Moderna has not asked permission to extract an extra dose from its vials? Because I understand its vials are 10 doses per vial. And also, Manitoba today is saying that it's going to buy, it's bought 2 million doses of Providence Technologies vaccine, which I guess is still in very early clinical trials. Are you encouraging provinces at this point to go it alone and strike their own agreements with companies?
It's Dr. Njoo. I can just start on one part of the answer. Certainly, we understand, respect that there is the single regulator at the federal level for all vaccines that wish to be approved in Canada for use. So I'm not quite sure I understand in terms of how individual jurisdictions may enter into any sort of agreement with sort of at this point sort of unapproved products. I think we need to wait for Health Canada to get a submission from whatever company for whatever product and go through the sort of the very strict and regulatory process for approval. After at that point, I would also say, and certainly Ms. Reza and Major-General Fortin can speak to it. I think that there's always, I say, economies of scale, and that it's always in some ways better for quote that sort of the government of Canada, as a bulk sort of buyer on behalf of Canada and the provinces and territories to enter those types of agreements. But that's just sort of my first reaction. I would certainly defer to Ms. Reza and Major General Fortin for to elaborate on that. Thank you.
I have no specific comment on that. Just say to bring to the attention that the federal government stepped into doing consolidated buying in PPE. I think it's the same approach that we have done with vaccines. Provinces and territories continue to do their own things in this element. And just to circle back to your question about Moderna, this question is best placed to the regulator. To my knowledge, they have not entered into similar discussions in terms of going to more doses per vial. That being said, I want to underscore that we're planning for these eventualities. When we look at different vaccines coming on, we have to be able to be flexible and have the supplies and the training and the tools that we need to be able to actually operationalize and get those extra doses out as the case may be. Thank you.
Well, thank you. C'est ce qui met fin à ce briefage technique. This is the end of this technical briefing.